End the patent now! End the patent now! End the patent now! End the patents now! End the patents now!
5 years since ME/CFS was first identified. Greedy companies overlook widespread conditions like ours that are underdiagnosed because they don't think there's a big enough market to be worth it. VIH y la encefalomielitis miálgica, o ME/CFS por sus siglas en inglés, que es un síndrome postviral que ahora se observa con mucha frecuencia en la gente que padece.
End the COVID vaccine patents, share manufacturing, and funding global production. Thank you. Since then, despite those public platitudes, no actions have been taken. We call on the United States and Canada and Germany and the UK and the rest.
So we have these tombstones now.
We invest in building resilient healthcare systems and targeting zoonotic diseases at the source. My father loved this country so much, and it kills me every day to know that this could have been prevented if our leaders stepped.
Vaccinate the world! Free the vaccine! 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 Vaccinate the world!
4 times as many people have died of COVID in the low-income countries than in the rich ones. And let me say, their lives also matter. And their deaths also matter.
That's right.
Now, Big Pharma's already made billions in profits. During the pandemic, the world's 10 richest men saw their fortunes doubling at a rate of 1.3 billion a day. 9 new billionaires were created by COVID profiteering. Meanwhile, the pharmaceutical companies are continuing to record over $1 million in profits an hour.
Surely after the most deadly global pandemic in decades, somebody, somewhere would do the right thing. The US government, other nation states, hell, maybe even the companies themselves would take bold steps to make sure everyone, everywhere could get a vaccine. Yet in the 16 months since then, more people around the world have died from COVID than in the first half of the pandemic. Our own government is urging a return to normalcy, seemingly forgetting the 2 highly contagious and deadly variants we've seen in the last 6 months alone. Until we get vaccines to everyone around the world, the next variant will always be just around the corner.
What separated those who lived versus those who died? The answer is always money. Why did my dad die alone at a community hospital after being given hydroxychloroquine, while patients at select private hospitals were given remdesivir clinical trials? And now this wealth disparity is playing out on a global scale. There are billions of people in the global south who are still waiting for their first COVID vaccines. And as they wait, the virus continues to devastate their unvaccinated communities and mutate into deadlier variants. The last time I saw my father was seeing him smile and wave from the stretcher as he was wheeled into an ambulance. The hospital itself was a war zone. We didn't know if he was dead or alive. On the 4th night, I received a call to let us know that he'd been intubated, and my heart sank. At this moment, it became very real to me that my father was going to die. And 3 days later, on April 13th of 2020, I got the call that still haunts me to this day.
While our government is trying to get us to go back to normal and take 5 days instead of the 10 days. Come back to work, it's fine, you can be here, you don't have to wear a mask. People in the global south are vastly under-vaccinated because of pharmaceutical greed and the lack of being able to get vaccine doses out.